Hello, my name is Sarah Thompson, and I'm a third-year pharmacy student at the Ben Fish College of Pharmacy at UT Tyler. And today I'll be going over amiodarone with you. Amiodarone is also referred to as Nexterone and Pacerone, and it comes in an IV or oral tablet. So you may be wondering, why are you taking this medication? Amiodarone is used to treat certain types of abnormal heartbeats, more specifically ventricular arrhythmias. Amiodarone can be taken with or without food, but should be taken the same way every single time. If you take it without food and you notice that it upsets your stomach, go ahead and start taking it with food. If you're also taking cholestyramine, make sure you take amiodarone either 1 hour before or 4 to 6 hours after taking cholestyramine. If you happen to miss a dose, go ahead and skip the dose that you missed and take the medication when you normally do. Never take 2 doses at the same time or extra doses. Some side effects that you should be aware of are signs of allergic reaction, so rash or hives or feeling like your throat is closing up. If you have signs of liver problems like yellowing of the skin or dark urine. If you have lung or breathing problems, signs of thyroid problems, so like weight loss or intolerance to cold. Changes in eyesight or eye irritation. Dizziness, so amiodarone can actually cause low blood pressure, so that's something you're going to want to watch out for. Or an abnormal heartbeat that is new or worse. So if you notice any of these, you want to contact your doctor right away. So something that's important to note about amiodarone is that it has an extremely long half-life. As you can see, a single oral dose can stay in the body for 15 to 142 days. A single IV dose can stay in the body for 9 to 36 days. So even after you stop taking this medication, it's important to monitor for side effects even months after you've stopped. So some things that you should tell your doctor before starting this medication is if you're allergic to this medication or any part of it, if you have a heart block, sick sinus syndrome, shock caused by heart problems or slow heartbeat, if you have low magnesium, calcium, or potassium, if you're taking any other drugs that can cause prolonged QT interval. You also should give your doctor a complete list of all your medications. That includes your prescriptions, over-the-counter, natural products, and vitamins. And lastly, you should let your doctor know if you're breastfeeding. Amiodarone should be stored in a dry area at room temperature, protected from light, children, and pets. Never store your amiodarone in the bathroom. All right, so to recap, I've created this little quiz for you. So number 1, where should you store your amiodarone prescription? Is it A, in a drawer accessible to children, B, in the bathroom, C, in a dry area away from light, or D, on the kitchen counter by the stove? I'll give you a second. All right, good job. Yeah, so it is C, in a dry area away from light. A is incorrect because you want to keep it away from children and pets. B is incorrect because you never want to store it in the bathroom. D is incorrect because you want to protect it from temperature. Okay, next question. Which of the following is not a side effect of amiodarone? Is it A, hyper or hypothyroidism, which is high or low thyroid hormone? Is it B, high blood pressure? C, lung or breathing problems? Or D, irritated eyes? I'll give you a second. All right. Great job. Yeah, it's B. So amiodarone actually causes low blood pressure, and it's very important to monitor your blood pressure while taking amiodarone. All right, last question is, which of the following is false about amiodarone therapy? Is it A, amiodarone has a short half-life? B, amiodarone can cause low blood pressure? C, amiodarone is used to treat ventricular arrhythmias? Or D, amiodarone may cause hyperthyroidism or hypothyroidism? Okay. That's correct. So amiodarone actually has an extremely long half-life, and that's why it's very important to monitor for side effects even months after you've stopped taking this medication. Okay. If you have any more questions, there's a link below this video to a patient education pamphlet that has more information on amiodarone. If that doesn't answer your question, do not hesitate to reach out to your doctor or pharmacist for any other questions or concerns that you may have.